USMLE style question, epidural hematoma. A 34-year-old man is brought to the emergency department after a motor vehicle accident. He was the unrestrained driver of the vehicle, which collided with a tree. Upon arrival, he is conscious but confused, with a headache and nausea. His blood pressure is 180 mmHg, and his pulse is 90 BPM. Neurological examination shows right-sided weakness and slurred speech. A CT scan of the head shows a biconvex-shaped, hyperdense mass located between the skull and dura mater on the right side. Which of the following is the most likely cause of this patient's condition? A. Rupture of bridging veins. B. Rupture of middle meningeal artery. C. Tear of venous sinuses. D. Intracerebral hemorrhage. E. Subdural hematoma. Answer: B. Rupture of middle meningeal artery. Explanation: epidural hematoma, EDH, is most commonly caused by rupture of the middle meningeal artery, typically following trauma, e.g., head injury, motor vehicle accident. Characteristic features: biconvex, lens-shaped appearance on CT scan. The patient may initially be conscious, lucid interval, but can rapidly deteriorate as the hematoma expands, causing increased intracranial pressure and neurological deterioration, e.g., altered mental status, focal neurological deficits like hemiparesis or speech problems. Classical progression: brief lucid interval followed by rapid deterioration. Why other choices are incorrect? A. Rupture of bridging veins causes a subdural hematoma, SDH, which has a crescent-shaped appearance on CT. Unlike EDH, SDH typically results from shearing forces during rapid deceleration or fall. C. Tear of venous sinuses can lead to venous sinus thrombosis or subdural hematoma, but this typically results in slower onset of symptoms and is not as sharply localized on CT. D. Intracerebral hemorrhage within the brain parenchyma, usually resulting from hypertension or vascular malformations, not typically due to trauma. It has a more diffuse appearance on CT. Subdural hematoma, typically caused by tearing of bridging veins, resulting in crescent-shaped hemorrhage on CT, and often associated with gradual neurological deterioration, not rapid deterioration like EDH. Clinical relevance: treatment of epidural hematoma. Surgical evacuation, craniotomy, is required if the hematoma is large or if the patient has deteriorating neurological function. CT scan is the diagnostic imaging of choice to differentiate EDH from other types of hemorrhage. Lucid interval, a key feature of EDH where the patient briefly recovers before deteriorating again due to expanding hemorrhage. Clinical signs of increasing intracranial pressure: decreased level of consciousness, pupillary dilation, and signs of brain herniation, e.g., decerebrate posturing, loss of reflexes. Would you like to explore another neurological trauma-related